muscle here, peroneus longus. You see here it forms a tendon, and see the tendon goes into the foot here. Understood? So this is peroneus longus. You see this muscle, it forms a tendon. The tendon goes here, comes out here itself. So this is peroneus. Understood? Peroneus longus is usually at the higher level. Peroneus brevis is usually at the lower level. Understood? Here it all appears to be fused together because of plastination.
Oh, okay.
Understood? So to avoid confusion, usually we pin the muscle here. So now you know this is peroneus longus, peroneus brevis. So always again look for where the tendon goes. Understood? Okay. What is this structure?
Lateral malleolus.
This is lateral malleolus. Okay. Just to tell you, what is, if I pin this structure, what is this? Suppose all of you are answering everything very well. I decide, okay, all the entire batch is highly intellectual. Then I pin this. All right. What is this? Huh? Something. Yes, this is extensor retinaculum. Clear? Here you will have flexor retinaculum. What should be this retinaculum? It's covering which tendons? See, it's covering which tendons? What are these two tendons? I told you just now. Peroneal. So what retinaculum is this? Peroneal retinaculum. Anyway, okay. I won't ask that, don't worry. All right. We have identified this. Okay. Let's go over to what of structures are broken. Okay, I'll pin these structures. See, here you will have a retinaculum which is called flexor retinaculum.
Flexor. Oh, okay.
No, retinaculum will be here.
Oh, it's not in this.
It's not there.
Oh,
now.
okay.
We have removed it. Whoever took this, they have removed that. Okay. Now I have pinned 1, 2, 3. Let me change the color of this because I'm pinning an artery. I don't want you to say that is a vein. Okay. All right. See, 1, 2, 3, 4, and 5 structures. All right. All these structures come from the posterior compartment of the leg, deep structures. Usually we remember by a mnemonic called Tom, Dick, and Harry. Clear? Nowadays, you know, the Americans have changed the word so much. If I use the word Dick, then it becomes a problem. All right. So now we have to find another mnemonic now. Clear? So the doctors are not here. The the doctors are not here.
Here.
Here, H-E-R-E.
They are not.
Here.
Clear?
Me too.
Now you can say what is the arrangement of structures that are here. All right. T stands for tibialis. Sure. Okay, tibialis posterior. Understood? No, you should not get worried sometimes when I ask something like this. What is the next word?
D.
Yes? The doctors. D stands for digitorum. So flexor digitorum longus. So this maroon color tendon is flexor digitorum longus. Because remember, this posterior compartment, all the muscles are going inside to the foot, right? They do flexion of all the toes. So flexor digitorum longus. Understood? Okay. The doctors are A for artery. Which artery here? Posterior tibial artery. Not N-O-T. N stands for nerve. Which nerve goes into the foot? Tibial nerve. So the yellow color is tibial nerve. And lastly, if you see one more tendon which I have put here in green color.
Hallucis.
Yes, hallucis. Which hallucis?
Flexor.
Flexor hallucis longus. So this is the arrangement of structures in the
Back.
flexor retinaculum of the foot. Clear? This area is clinically important. Surgeons will ask you because all of you would have heard of something called arteries of peripheral pulsations. Which are the arteries for peripheral pulsations? Yes, any artery that is on the appendicular skeleton. Anything other than thorax, any other place, it is considered. All of you know what is torso, right? What is torso? You remove the head and neck, you remove the extremities, only the abdomen and thorax put together, it's called the torso. Any arteries outside the torso is considered to be arteries of peripheral pulsation. So what is the artery in the neck? Carotid. Which carotid? If I ask you which carotid is palpated for pulsation, common carotid, external carotid, internal carotid? Common carotid. Understood? You will not palpate external carotid. Clear? Internal carotid also no, it's common carotid artery. What is the artery that is present here in front of the ear? Superficial temporal artery in front of the tragus. Clear? You have an artery. So that is artery of peripheral pulsation. Now in between these two, near the mandible, lower border of mandible, you have an artery. So 3 arteries, 1, 2 and 3. Sometimes I have to take your mind off this lower limb and come back here. Yes, facial artery. Understood? Fine. These are the 3 arteries here. What is the peripheral arteries for pulsation here? Axillary artery is one, which usually we don't do. Then we have brachial artery. Then we have radial artery. Understood? Ulnar artery is not for pulsations. Which is the principal artery supplying the forearm? Which, if I ask you to remove radial artery or ulnar artery, which one you will remove? You will remove radial. Why?
Because the ulnar supplies
Larger branch.
can supply the long arteries.
Remember, the principal artery for forearm is always ulnar. Ulnar is a larger branch, terminal branch, and it is the main supply to the forearm. Clear? Radial artery is straight comes here and it joins here. That's it. It doesn't give too many muscular branches. It's all done by ulnar, including interosseous arteries. Everything is done by ulnar. Understood? Okay. The lower limb. What are the arteries for peripheral pulsation? 3 arteries you should remember. Femoral artery, posterior tibial artery. What is the other one? Popliteal also you can say, but just like axillary artery, popliteal artery is the deepest structure. So feeling popliteal artery pulsation is little difficult. But these you can feel. Which is the one more artery which is very, very important. See, remember, in the lower limb, arteries are not mainly important for palpating pulse. They are important for disorders. Understood? So in pathology you would have studied about a disease called TAO. Disease of the blood vessels was done? Thromboangiitis obliterans. That is a disease which is common for chronic smokers. Understood? So anyone who comes with the history of chronic smoking and pain in the lower limb, you should always feel for femoral pulse. You should feel for posterior tibial artery pulsation. You should also feel one more very, very important artery, dorsalis pedis artery. Clear? Dorsalis pedis artery will be here. You should feel these 3 arteries. Anyone who comes with pain in the lower limb, arteries are important. Diabetics also can have, not TAO, but they can have atheromatous plaques, which can block the femoral artery. Clear? This is very, very important for your clinical practice. So now you know all the tendons here. What are the tendons? Tibialis posterior, flexor digitorum longus. This is posterior tibial artery, tibial nerve, and then yes, flexor hallucis longus. Clear? Okay. Now let us remove this. Anyway, one structure is not there for you.
Real.
But remember, sometimes we can always glue it back and keep here. Okay? This is the problem with plastinated specimens. As it ages, it starts breaking. It has to be replaced. Now let us go to the foot. Okay? I think it stands. Okay. See, in this model, what are the things we can see? I'll pin the following structures. Okay. All right. In this model, what are the things we can show? See here, I am showing you something nice white in color in the center. You can see that this white structure which I have pinned here. See here, it gives one branch here, one here, to all the 5 toes. Do you see it gives branches or divisions? If you see anything like this, then always it is safe to say this is plantar aponeurosis. What is it called? Plantar aponeurosis. In the palm, what is it called as? Palmar. What is the difference? Very easy. State one difference between the pinned structure and a similar structure in the hand. What will you write? If I give 4 marks, just one difference. That is the difference. Yes. What is this? No, location is fine. You have told it's plantar, you know it's plantar aponeurosis because now I have told you. Right? You will write plantar aponeurosis, yes. But my next question is for 4 marks, you have to win a lottery. If you write one difference, yes, you got it. You can move to the next station. If you don't answer,
The shape.
4 marks are gone.
The shape.
Remember, in the Palmer aponeurosis, you will have only 4 divisions, only for 4 digits. Thumb is not included. Understood? But plantar aponeurosis will give slips to all the toes. That's why initially when I told see 1, 2, 3, 4 and 5. I told if you see all the toes, then safely say it is plantar aponeurosis. Because in the upper limb, remember, in the hand, thumb is not included in any of the structures that mainly go in the center. Thumb is always separate. Understood? Palmer aponeurosis will give only 4 slips to only 4 digits, but plantar will give to all the digits. Clear? Okay, that's one question I can ask. What is another question I can ask? Anyone wants to be an examiner for some time? I can ask attachments. Yes. What else I can ask? What is the function of the pinned structure? What will you write? What is the function of the pinned structure? See, we are finishing sole of the foot. We'll go to the next model and see something else. Yes? Huh? No. See, remember, when a patient is brought into the emergency ward, you are left with no time because we don't know how much time the patient was lying outside. If he comes in an ambulance, we know that paramedics would have resuscitated, they would have taken care of the vitals. What if he is brought in a car by an unknown person? What will you do? We don't know how much time he was spending there in the car, right? And we don't have a siren also to make the people move, traffic jam in KL. What to do? So you don't have time. You will have very less time to decide what is wrong with the patient, what to do. So you should know all these basic things. A function is to maintain the arch of foot. There is something called tie beam. Have you heard of the word called tie beam? See, the arch of foot is maintained by many structures. Yesterday we saw center stone. Clear? Similarly, you will have ligaments and you will have structures binding the 2 ends, holding it together. So the function of plantar aponeurosis is to act as a tie beam to maintain the arch of the foot. That is the function of plantar aponeurosis. Got it? Okay, now I have leaked the question also. Hope you will remember. Alright. Next you can see here, there are 2 muscles that go from the calcaneum towards both the ends. One on the medial side, one on the lateral side. See this muscle here? See this muscle? The muscle will be here, the tendons will be here. These 2 are called as abductors. Abductor, AB, abductor. Understood? So this is going to the great toe and this is small. So this is called as abductor brevis, Alice's brevis. Clear? Even if you say abductor hallucis is also fine. But you should know this is an abductor hallucis. This is going to the little toe. So this is called as abductor digiti minimi. Watch carefully. I have put 2 pins again just in front of these muscles. These are 2 different muscles. Understood? These muscles are flexor digiti minimi brevis. This is flexor hallucis brevis. Understood? That's why I told you in the beginning. You see the muscles will be here, the tendons will go here. Then these are abductors. Understood? If I put a pin here in the front, it has to be flexor. It cannot be abductor. What is abduction? See,
Away from the
in digits, abduction is this. Clear? Fanning of the digits is called abduction. Understood? So naturally what happens to make these 2 digits move sideways or open wide, the fibers have to go on the side and then do it. Understood? So that's why you can see the muscles here, the tendons go on the sides. That's why they are called as abductors. Clear? Flexors means you have to make them contract like this. Flex. So naturally they will go from the center. So that's another way to identify which muscle we are asking. So always remember, if I ask 2 muscles of the sole which is more close to the calcaneum here, then it has to be abductor. This is abductor hallucis, this is abductor digiti minimi. This is flexor digiti minimi brevis, this is flexor hallucis brevis. Understood? So these are the structures you can identify in this model. Okay? See, next time any one person can record, or you can keep the this thing, what is that, mobile phone with a stand on either side. Maybe you can record, and I want all of you to see what I am showing here.